very brief presentation, but a big part of the work I'll be doing together with you as you reflect on what it is that you've gone through and, having whatever questions you may have as we move on with the session. So on that note, I am going to start with the formal part of the presentation. And Vilmarie, I will rely on you to just let me know if there's any questions. I'm quite comfortable to pause and answer. You'll guide me in terms of how you'd like for us to do it. If anyone has any questions, jot them down. Some I might be able to, respond to today, some perhaps not for different reasons. And so, yeah, let's start with the session. And I really look forward to engaging with you. Thank you. Oh, and a bit of a disclaimer. We are in winter, so I've got a bit of a scratchy throat. So here and there, you might just see me taking a bit of a quick breather, but I am with you and we are going to be having this discussion. Thank you very much. So I'll start with the presentation. If you look at the title of the presentation itself, I know, getting the invite, we came in because we want to understand how we as family members of individuals who are, suffering from addiction, how can we be of, support to them, etc. And I've got on here that it's not only just family members, it's actually a group of carers. There's many of us who care for individuals who have got, different types of addictions. And I'm just going to ask, I've just hit load shedding, so I just want to put on my headphones because I realize that now the generator on my end is giving a bit of noise. So give me a quick second, please. Thank you. Okay. I hope I'm still audible. Thanks, Volmarie. Right. So what I've got on, I see there's a hand up. Vilmarie, can you guide me, please?
I also saw there was a hand, but I think they
Gone.
lowered it again. Yeah.
Okay,
Lucinda, just put on your video again, please.
sure thing. Will do.
There we go.
Okay. So what I was just saying to you is that what I've got on here is the session that we're going to have this afternoon is about what I call the wounded carer. And you may ask, who's a carer and why wounded? Well, when you have a loved one who's going through an addiction, without fail, be it a friend, be it a neighbor, be it a family member, whoever they are, be it your partner, ultimately you will have certain wounds. Whether those wounds are inflicted on purpose or not is a different story altogether. But ultimately, you are going to be someone who is showing that they care, but you are also wounded at the same time. So as I start, I've just got a couple of topics. I did say it's not going to be a very long one. I'm just going to do a very high level overview of addiction because I know this is a session that's been done previously. So it's literally just me easing through and almost doing a bit of a reminder. Paul, can you please assist us with that audio? Thank you very much. So yeah, I will take you through just a bit about addiction and quickly through the treatment of addiction, and then what the role of, the person who's a carer is, and the impact that addiction has in families, and what I often call in therapy the cost of caring, because sometimes we really have to pay for just caring for individuals, our loved ones, who are suffering from addiction. And you'll note I speak of suffering because whilst it may look like they intend to and they're doing all of this on purpose, but I can assure you, often than not, it's part of the illness presentation that they are actually just living through. And thereafter, I'm going to take you through what would be just a couple of self-care tips that individuals can utilize for themselves. And then I'll take you through just a couple of support resources that are available to us as South Africans. So when we speak of addiction, what is addiction? It's easy for us to say I'm addicted to coffee, I'm addicted to smoking, and we label other people and we say they're addicts. But what is it essentially? What you need to understand is that there's different types of addictions. Individuals can have addictions to different types of substances. They can have addictions to different types of drugs. There's many that are available. I'll speak of the South African context. There's quite a number of them. And for us to say an individual is suffering from an addiction, essentially what we're saying is we're noticing that this particular person has this, let's call it an all-consuming kind of relationship with a particular substance, be it conscious, be it unconscious, but ultimately they do so and they use that particular substance with a view to get a different kind of result where they feel a certain way. Sometimes they'll do it from a social kind of perspective. Some will also do it as a means to self-medicate. Okay. Can I get assistance with that audio, please? If we can just switch off that mic, please, because I'm getting a bit of feedback. Thank you very much. Ultimately, though, when we speak of an addiction, what we know for a fact is that often than not, that that individual will undergo certain, let's call it unpleasant kind of consequences. Now, when we speak of addiction, society and media, social media would have us believe that addictions happen only to people who have got certain types of problems or who come from certain social backgrounds, etc. And the reality is, addiction can actually happen to anyone. You know, it can happen, within a family that is loving, a family of any, socioeconomic background. It can be your educated kind of individuals. So for us as psychologists, mental health practitioners, your psychiatrists, we often speak of addiction as an illness, as a mental illness to be precise. And I mention this to you because, like I said, I alluded to in the beginning, when we see individuals addicted to certain substances, it's easy to say, but he should know better. He should be containing himself, etc. But the reality is, because it is an illness, sometimes you may find that the ability to control, the ability to respond to might just be compromised because we are, after all, dealing with an illness. And in terms of, how it impacts the actual individual who is using the substance, who's using that particular drug, it causes, numerous, physical symptoms, sometimes resulting in certain physiological illnesses, and sometimes even resulting in death. And moreover, it can also result in quite a lot of psychological damage. And the reason why that is because once a person is under the influence of a certain substance, that person can no longer control how they're feeling, how they're responding. They struggle to even identify the emotions that they go through. And because I also speak of the physiological, it also even guides how they end up even acting because, you know, it ends up having this long lasting, we call it quite a powerful influence on the individual because once one is addicted and they, stop taking that particular substance that they use, often than not, you'll find that they experience extreme cravings. Hence, you find that sometimes People will, maybe promise that they will no longer use, and thereafter you find that they go back. But the reality is that physiologically, there is now this craving that they can't control. So, meaning that they've lost all control in actual fact. And thereafter, they just continuously, involve themselves in means and ways to attain that particular substance. It is, can be quite confusing at the best of times to understand why a person may even risk their family, why a person may risk their job because they want to use a substance. And that's the reality because it is an addiction. We need to get to a certain point for us to actually diagnose and say, this person is actually addicted because their overall functioning has gotten to a point where it's actually impaired. And they struggle to thereafter, contain certain things. And we often say, as a means to try and explain this, we say, you know what? The addiction actually gets to hijack a person's brain because of the numerous changes that one's brain actually goes through. And it starts from, the time they start with the drug and they experience this sense of pleasure. And, then the desire is, I need to continuously be in this state of being high. Hence, then the compulsive behaviors that we see thereafter to ensure that one continuously has the supply of that particular drug. Some of us know of, many individuals where you find that, people may even get to a point where they still, they sell things from the house. They sell stuff from the house because they can't quite help, how they're feeling. Um, and ultimately, it can also lead to other mental illnesses as well, where we end up diagnosing with other, different types of mental health disorders as a result of the use that we are noticing, right? And it doesn't matter, often than not, once a person is at that, advanced stage of the, of addiction, you speak to them daily and you think they hear you, but what you need to realize is that they hear you, but inside is a different process that they find themselves going through. Hence, then, the conflictual responses that you get. Hence, we find ourselves, struggling to understand why, why. Now, in terms of the treatment, I did say I'm just, skimming through addiction because I would like to focus on you, the individual who has been affected at this point in time. In terms of how, we as professionals get to treat, cases of addiction. It's never a one size kind that fits all. By that, what do I mean? There are several factors that we look at. We look at the type of, addictive disorder. I did say that from our perspective, we do end up diagnosing, you know. So we look at what is it that the person is using, how long have they used that, how much are they using, and how does it affect the actual individual? And that informs the kind of intervention. Hence, you may hear of certain individuals who would say, I went for outpatient care and I was fine. Whereas there's certain individuals who may end up going into what would be your inpatient kind of facilities to get, further management. So all of these factors actually play a role. And often than not as well, because I am in the mental health space, we often hear families, we often hear the clients themselves saying, I would actually prefer to be an outpatient. And there's disappointment when the recommendation is that actually, no, we need for you to be going into a facility where you go through a detox, for example. And again, that is dependent on what the person is using, the magnitude thereof. Now, others will say, I know there are certain classes or certain support groups. I'm just going to attend a support group and then I'm going to be good. But sometimes, again, because we assess and we often say, rather we bring our loved ones, let's bring them to mental health practitioners for those assessments. Let us be the ones who guide you because we'll work on what we are seeing rather than what would actually suit you as a family or suit the status or suit their role. And I say this often because let me tell you, I'll give you an example of, individuals who occupy your executive roles in companies, for example. Sometimes that person may find themselves being an addict and they are wary to actually go into an inpatient facility simply because they fear the stigma that I am someone who is highly esteemed in society. Whilst we acknowledge that, and yes, coming into any facility, the aim always is to treat with the utmost empathy, with the utmost professionalism, but ultimately allow us as the practitioners to guide you because we would have somewhat of a better understanding around what would be the ideal, right? And why then do we want for individuals to be in treatment if they are suffering from, addiction? It's to help them to be drug free and to also prevent relapses, because that's another thing that we see quite often. An individual would have gone into let's call it a rehabilitation program. And whilst they're in the program, the expectation in inverted commas is that after this, everything should be fine. There should never be any problems. But sometimes there are, and that is because of the complication that comes with addiction, because then one comes up with a confluence of dynamics where you find that perhaps now there's been anxiety that one has actually developed. There's depression that's come into the picture, or perhaps the depression was why the individual went into using substances to begin with. So again, it depends on the individuals, and there are also the self-help groups that are alluded to. Often than not, these are very important, and it's always encouraged that we shouldn't be shy to get our loved ones to even continue with that, let's call it maintenance care, after they get discharged from facilities. Now, someone else might say, but I'm seeing a psychologist and I'm also supposed to go to the group. Isn't that the same thing? And no, it's not. Because when you go into a counseling session with a therapist, what you're going to be going through is your, counseling interventions that actually help you to understand yourself better, that help you to understand why you find yourself in the position that you find yourself in. So it's quite individually focused. With that being said, though, there are also group sessions, and these are your therapeutic kind of group interventions. Again, it's different from what would happen in the individual context, right? In the group interventions, you find that there's a lot of sharing around, stuff that individuals have gone through. And the key thing there is to help the individuals to feel safe, to get to normalize their experience, not the use, but the fact that they are on their road to recovery, because that road is laden with a lot of difficulties. And often than not, we hear of family members saying, Vilmarie, I see your hand is up.
Yes, sorry, Lisanda. I see there is already two questions, and I think they are very relevant to what you're talking about. They ask a recommendation for institutions that can assist addicts, and also what is the process a carer should follow for a gambler and an alcoholic abuser to support the loved one that is suffering from the above addictions.
Okay. After we're done with the session, Vilmarie, what I'll do is I'm going to share quite a number of contacts with you, because there are various facilities that are available throughout the country, and they differ in terms of what it is that they attend to, right? Depending on the kind of addiction that we're referring to. Some are state funded, some are privately owned as well. So it differs according to where we are. So we'll definitely share that after the session, right? And then in terms of what do we do, what can I do with my loved one who's going through this? We often recommend go straight, if at that point, your loved one does not pose any risk to harming themselves or harming another person, because if that were to be the case, we would need to start with managing the threat to harm first before all else, right? Because we want to triage, what is happening and the urgency thereof. Now, for someone that is not posing any risk, in terms of just immediate danger, that is, we will always recommend that you speak to a mental health professional. Why is that? So that the mental health professional gets to have an understanding of what it is that is happening with the particular, loved one who's going through that experience. And they get to make recommendations based on those factors that I mentioned. So you often hear there's a psychologist involved, and then there's a social worker involved, and some people get to, become despondent because now I'm seeing all of these people. But the reality is we are all part of the, let's call ourselves the multidisciplinary team, who are there to manage all of these various dynamics that individuals present with. And so each one becomes quite important. And because our topic for today is speaking to the carers, as part of the counseling intervention as well, sometimes we may even recommend your family therapy kind of interventions. So it's important that from the get-go, we become a part and parcel of just getting that person to get the support that they need. So yeah, that would be just answering this. And actually, you were right. It speaks to exactly where we are. The last one as well, when it comes to the treatment, quite high level overview as well, is just medication. And that is where now part of the multidisciplinary team, you would be getting that doctor who would now also make a call as to what medication would be required. And medication would, of course, be informed again by the various, dynamics that the person is presenting with, and whatever other, let's call it, other illnesses or other complications that may have arisen as a result of that particular addiction. Okay. Now, let's come to you as the carer who's sitting here. And, I did say in the beginning, as I, talk to you and I walk with you this afternoon, listen and reflect. It's not only just about receiving the information. Ask yourself, where am I? And why are things like this? Why am I so affected? Why is it because I don't have boundaries? Why am I involving myself in my sister's addiction so much? Why am I involving myself so much in what is happening with my partner? And I'll tell you, the reality is because addiction is a family disease. It's not just one person who gets to be ill. It's the whole system. If it's friends, it's the whole system of friends. We all get impacted. We sit with the impact of the addiction, and we then start to have a certain, let's call it a responsibility. Whilst it may feel unfortunate, whilst it may feel unfair that we are finding ourselves in this position, but it is happening to our loved ones. And so we then now have this role to fulfill, where we now need to understand the impact that it has on us, so that when we get to a point where we come up with interventions, where we start to seek help, we seek help in line with what we are going through. We also would benefit from even understanding, what is this addiction that my loved one is going through? What is it called, and how does it play out? Because often than not in society, we make the grave mistake of comparing, because we use these loose terms. So and so's son is an addict, but he was able to go into the facility and he was fine. Why not you? But the thing is, you don't understand what kind of addiction the other person had. And having that understanding as well helps us to support this person. It helps us to support our loved one. And throughout, their treatment journey, because that treatment journey, at the best of times, is chronic. It doesn't end, because ultimately they have this illness. And therefore, it's important that we start understanding, even, though some of us may be already frustrated and we're despondent, but ultimately we play a major role in assisting our loved ones to manage, what would be the substance use disorder, what would be that addiction, that addiction that they've been diagnosed with, and the subsequent mental, illness concerns that come out. Um, because ultimately you are impacted. So you are impacted. And even your health at that. And you might wonder, but no, Lusanda, I'm fine. Well, who's the one who's not sleeping at night, worrying about your loved one? Who is the one who gets to work and you've got that headache because you're thinking so much about what, is happening with your loved one who's going through, this addiction? So we often then say, we have to interact with the addiction and acknowledge it, even in spite of the fact that we're tired, even in spite of the fact that we find ourselves walking around, walking on eggshells around this person who's going through this addiction because we want to avoid triggering them. We want to avoid conflict that comes up when, they have, they're under the influence of whatever it is that they're taking. Ultimately, the addiction just becomes this, in inverted commas, this organizing principle around which our family lives get to revolve. And I'll give you an example of what I'm talking about. So if you have a brother, for example, who is an addict and who's gotten to a point where they start to steal stuff from home in order to get money to buy whatever, substance they're using, it means as a family, we don't just leave the house. We have to think. It's almost like we have to be on a roster, of sorts, deciding who stays home with him so that we can, keep guard that he doesn't steal, or, who does what, who accompanies our sister when she has to go to a certain place. Hence, then I say it gets to become this invisible family member. And that's our unfortunate reality, a truth, but that we can manage because ultimately individuals who are going through addictions can be assisted. And you may ask, but no, I'm tired. We can never give up, we'll always continue to try. Although, with that being said, the focal point of our discussion today is you still matter because your health is also important, in spite of you trying to look after that loved one, in spite of you supporting that loved one. Now, let me tell you, the impact of an addiction in the family, it varies. The child, if it's a parent or if it's parents, the child gets to be affected. If it is a child who's a user, the parents themselves get, affected. If it is a sibling, the siblings also get to be impacted. What does that look like for a child? Children often also become the invisible victims in this whole scenario by virtue of the fact that children often don't have much to say. They have minimal demands. And when we are sitting with a crisis, because someone is using in the family, we tend to put them on the side. And that has a dire impact ultimately in terms of their well being. What is this impact? It means this child is existing in a home where it's emotionally, psychologically, physically unsafe for them. And another one that we tend to overlook, if it's going to be the parent in a single, parent household, or the parents, we tend to see this role reversal where you find that the child becomes what we call parentified because they have to now take on the role of the parent, where they have to look after the parent. Once the parent is intoxicated, once the parent is high, the child is the one who has to ensure that the gate is locked, the door is locked. The child is the one who has to hide the car keys because they know what is likely to happen. And all of that will likely have a psychological impact on that child without fail, right? And over and above that, in terms of the kind of support that we expect for children to get from their parents, you find that it becomes quite inconsistent because there are moments, of course, when the parent is sober, and so they try to overcompensate. Now, that, let me tell you, for a child, that mixed messaging that they get, where the one moment they are bombarded with these big acts of affection and support, and then the next moment, when dad is now in a state of being intoxicated, that contrast in terms of responses can cause grave, psychological damage. It affects how they then grow up. It affects how they relate with other people, where you find that they'll struggle with regulating their emotions. They're predisposed to anxiety disorders because they are in a household where they never know who they're going to see. Is it happy mom, or is it normal caring mom? And when I say happy mom, I'm referring to mom who's happy because there's been a substance, even if it is, an individual who's suffering from, let's say, a gambling addiction. Even then, they now have this duty to be mindful of what's happening with the finances. They are now having to run around ensuring that the grocery is done before dad can go to the casino, because we know that once he goes to the casino, there will be no more money. Now, those are all things that are not age appropriate for a child. And often than not, we find that children who grow up being exposed to, concerns around addiction, where it's parents, where it's caregivers, they're likely to start using substances as well. And you may say, but no, the child knew that this was wrong. But psychologically, that truth is the only truth that they know. What is that truth that I'm referring to? It is the truth that if you're stressed, go and hit the bottle. So that's all that they're going to do, despite their best intentions, by the way. They will find themselves going through that. And over and above that, what you find is that the children then find themselves having to always be sworn to secrecy, because when dad was high, he hit mom. And so we have to hide those things. So from a young age, then they learn to always keep such secrets, right? And often than not, because they are dysregulated emotionally, they're often predisposed to being abused, and they're predisposed to even being bullied at school. What happens with the parent if it is a child who's got an addiction? They're continuously worried. They are also going to find themselves experiencing the symptoms of anxiety, the depression, because they feel that they failed as parents. They ask themselves often, what did I do wrong? They feel powerless, they feel helpless, they feel hopeless. And then somewhere along the line, because this is a parent who wants to also prove to themselves that they did their part. They continue to do their part in inverted commas. And what is that part? That part becomes where they try to overcompensate with the child. And then there is this enmeshed sort of relationship that gets to develop, because there's now this inappropriate kind of dependency. I'll do this so that you don't do that. So what would be the normal progression of a parent to child kind of relationship to be compromised? And often than not, pretty much like the child, they will find themselves having this moral dilemma of sorts, because I must now hide, to the neighbors what it is that is happening in the home. And then there is the sibling. If it's an elder sibling or a younger sibling, often than not, those are the individuals that we sit with in therapy who find themselves with these, strong feelings of resentment. They become resentful because they don't get attention, because they're often reminded, you know what? We need to focus on your sister because right now your sister is struggling. As a result, they develop this poor self-perception because the kind of attention that they get gets to be quite compromised. And they sit with a lot of shame because now they are not using any substance. They are not addicted to gambling. They are not addicted to pornography even, but instead they have to hide these things because they get to school and their peers remind them of the shame that their siblings are actually just imparting on the family as a whole. And as such, these are individuals, even growing up, you find that they learn these attention seeking kind of behaviors, which are not necessarily the healthiest, simply because they learn from an early age that because the focus is always on my sibling who has got an addiction, for me to get any kind of attention, it means something serious needs to have happened. Hence, then, if I fall ill, then someone will start looking after me and I'll get the kind of affection and attention that I require. And then growing up, this you find eventually developing into what we would diagnose within your personality disorder kind of concerns. And again, because the substance or the kind of addiction that's just been in the house has become so normalized, they themselves, run the risk of actually using that particular substance. Now, it doesn't matter the role. I can be a friend. Ultimately, I said in the beginning, there's a cost because I love this person who's suffering from an addiction. And what are these costs that I refer to? I call them costs because we pay very hard. Some of us are in therapy simply because we're struggling to deal with our loved ones who are experiencing certain addictions. It is that loss of sense of self. And what do I mean by that? It's because, for a parent, for the partner, the girlfriend, the boyfriend, you find that your life now revolves around trying to control or fix the problem. If you find that your loved one is going through a phase where they are not using, for example, then you find yourself, overcompensating and really doing your best to ensure that they stay in that particular, state. And as such, who are you then? You start to withdraw even socially. You go through these feelings of guilt where you blame yourself. You think perhaps if I was a better partner, if I was a better wife, maybe he wouldn't. Because who goes when they're happy? Who goes and then starts using a substance in your mind, that is? When in actual fact, that's not the case. I did say that addiction is an illness. And once we are at that stage, yes, we need your support, but at the same time, don't take all of this and just shoulder it because ultimately it will burden you emotionally. And it doesn't help that, of course, because our loved one has got an addiction. What happens is, social invitations, tend to dry up. And what are these invitations? Well, if your loved one has had a history where at a social gathering at, the neighbor's house where they had a party, when he was there, he acted in a way that was quite untoward and there was chaos that erupted. Often than not, people will tend to move away from you by association with your loved one. You know, your children may be bullied, um, your friends, even your colleagues. They start to not trust you because your loved one was found to have stolen money the one day, or two cell phones went missing the last time that you were there with your son. And as a result, then you sit with this shame. And in that as well, because some of us are here not because we've got loved ones who are suffering from addiction, but because we know our loved ones who've got loved ones, who are going through addiction. So start reflecting on how you are even responding to those loved ones. Understand that in some of your behaviors, in an effort to try and protect yourself, you are also stigmatizing those individuals. Perhaps we may need to do it differently. Perhaps we may need to try and control where we meet, how we meet, etc. Because we do not want to be, alienating these loved ones that we have, because these are long-standing relationships that we've had with these individuals, right? And of course, when it comes to your mental illness, challenges, those will, even for the loved ones, come up because we're anxious. And don't forget that often than not, when an individual is under the influence, often than not, they will have, certain perhaps episodes where there's some level of violence that gets to happen in the household, be it in the form of breaking glasses, breaking windows, throwing tantrums, punching off walls, perhaps even being physically abusive to their loved ones. Now, what that does then for that individual who's the loved one is they will often find themselves just being, hyper vigilant because they never know when the next episode is going to come. And, there are times when your loved one may be, let's say, intoxicated. And fortunately, on that day, there isn't any problems. But even still, you can't quite be comfortable because you don't know when the next episode is going to be coming. So those are some of the dynamics. And then over and above that, with a person who's, suffering from an addiction, be it a gambling addiction, because that person will often manipulate you because they want to have their needs met. They want that money. And therefore, they would not, mind being deceitful because for them, it's just about getting to that point where they satisfy what I often call that emotional hunger. Be it a gambling addiction, be it a substance addiction, whatever kind of addiction, best believe there is this metaphorical emotional hunger that they're trying to actually, fulfill and fill up as well. So what that does as well is it leads to a sense of mistrust because now we can no longer trust this person. We struggle. We struggle to trust one another because the mother is the one who gave the son the money. The father now can't trust the mother. So it becomes, quite a vicious cycle of pain, a vicious cycle of, this moral decay as well. And I'll say that, I'll give you an example when I speak of, this more sense of moral decay, where you find that you start to have these gray areas when it comes to your morals because the one day your child may be caught with a certain substance and you are inclined to deny that. So what happens to your morals? You're seeing an illegal substance. You're not reporting because after all, this is your child. There's an accusation from a neighbor that your son, because he's got a gambling addiction, broke into the neighbor's car and they stole a cell phone with some of his peers. And yet again, because you're a parent, because you're a girlfriend, because you're a boyfriend, you cover that up. So that then starts to compromise even the morals that you may have had before. And again, that will lead to that anxiety. It's in the, drinking and driving kind of incidents where your loved one was driving and they get involved in an accident because they were intoxicated at the time, because they were high at the time under the influence of whatever substance. And we try and we hide that. When we go to the insurance, we say, no, I was driving, when we know that he was the one who bumped that car against the tree, just because there were no witnesses. So essentially, when I speak of, that loss of sense of self, you change altogether. And those are the things that pain you more than anything else. Yes, Valmarie, I see your hand.
Hi, Lisanda. Yes, there's also a question I think that's also relating to what you're talking about. It says, with regards to not wanting to alienate the addicted loved one and stigmatize him, how do we then, as parents, protect our children from him when we gather as a family? It is a concern that he might influence other children in the family, but at the same time, we want to assist him and make him feel part of the family.
A bit of a catch-22 kind of situation, hey? Because now we are concerned about other children, but at the same time, we do not want to alienate him. Many people find themselves in that position. Now, in that case, what we often recommend is it's what we would call your boundaries. So meaning that, yes, whilst there may be those types of interactions, you need to be mindful of your context. And your context is there is this person who's a family member who is an addict, right? And why I say they are an addict is because we often ask them to own that label, because it's not just to say it's just a by the way, they are going through this addiction. And by virtue of them going through this addiction, we understand that there are certain limitations in their sense of judgment. You know, they can leave the house with promises being made, but they get there and different things get to happen. So it's important that boundaries are set. So what does that mean? It means we get into that family, interaction. He's not the one to be sitting there for the longest time. And yes, he will be that one who will need to be monitored. That's the reality of it. Despite the fact that when you try and put those measures in place, they will get upset with you and say, but why are you acting as if I'm a criminal? But that's the truth of it. And we need to be honest, because in that honesty, they need to understand the impact of their behavior and how their behavior and that illness that they have, which is the addiction, how then it compromises who they become, how it compromises the things that they can do. So I'm saying that context is very important. So meaning for him, for her, it's a shorter period at the relative's house relative to the other child. And that's the truth of it. Those are some of the compromises that you can find. Is there any other question, Rosemary, before I proceed?
There was, it asked, there was a question. Sorry. What type of support is there for loved ones? And also supporting loved ones through withdrawal and craving. What can one do?
The kind of support that is available for a loved one would always be the social network. So what is the social network? It is not, isolating, not detaching from your loved ones, because ultimately they care about you. So that's the first part. But I do acknowledge the fact that sometimes we do get to that point because people get really frustrated when our loved ones are going through an addiction, because it causes quite a bit of, chaos when they are around, be it emotional, be it psychological. So over and above what would be your social networks, meaning your loved ones, your community of loved ones, it would be you seeking therapy for yourself, speaking to a mental health professional about some of the struggles, and a mental health professional would assist you with coping tools to manage whatever your loved one is going through. So, what does that mean? It means if you were to come into a session and I spoke of the moral decay, it is where you are reminded that, instead of protecting this person, you're enabling the behavior. So it's important that you set certain boundaries, because you also need to be quite consistent in assisting the various systems that support your loved one. As your loved one experiences certain, symptomology, like your withdrawal symptoms, when they are at that point, whilst it may be tempting to give them whatever it is that they need at that point to relieve that discomfort, that pain, because at times it can be excruciating and it's painful for a parent, perhaps, to look at their child going through that. It's important that you stick to your guns, because you know what the impact of this addiction is. And so trying to temporarily relieve that particular, let's call it discomfort, it will not necessarily assist for a long period, because instead they are likely to relapse because we are taking them backwards. But over and above that, when I spoke about treatment for addiction, I also mentioned family therapy, I mentioned medication, and I mentioned that an addiction becomes a family disease. So as family members, we need to, continuously be involved so that we can understand how to exclusively support our loved ones in view of their unique presentations. Not just I think I should, he should drink a lot of water. Water might not necessarily be what he needs right now. Perhaps he may need to be doing something else, for example. So the treating practitioners would actually give you direct advice around how you can actually support them as they go through various symptoms. And often than not, for someone maybe who's gone through a detoxification, you'd often be told what it is that you may need to do to support them when they find themselves going through certain symptoms. Okay? So just to continue with the costs that we then sit with as loved ones, it's the abuse that we have to endure. I spoke of boundaries being very important. Whilst we love them, but we still need to set boundaries. So if your loved one, because they are now throwing a tantrum, because they want the substance that they often use, because they are intoxicated, because they are high, you need to take the necessary steps to show them that you do not want that kind of behavior. You do not approve of that kind of behavior. Pretty much like what you do with a child, where you say, I don't want you to do that. And sometimes we do get to a point where we may need to call the police. The one thing that you find family members being wary to do, which is to involve law enforcement. But remember, at the end of the day, that individual is under the influence of something. And that means that they are disinhibited. It means that their ability to decipher between right and wrong is quite compromised. So, in your protecting them whilst they've broken the windows, we don't know what else they're going to break. They might also get physical with you, where they become abusive with you, where they do things that they wouldn't ordinarily do. So, understand this person is no longer themselves. So when you are calling the police, for example, you're trying to manage that symptom. Yes, of course, he or she is going to be the one who's going to be detained. But how are they going to learn if all the time windows are broken, glasses are broken, people are hit inside the house, you know, windscreens and windshields are smashed, and nothing happens and there is no consequences? So consequences are quite important for us to manage some of these costs that we sit with, because if you don't, your neighbors will call the police because they are hearing the noise, they're hearing the disruption, but you are not, following up on that. And that will become habitual. They will know that you are fine with whatever they're doing. Hence, then they continue. Because ultimately, remember, in all spaces that we exist in, that's why even in our workspaces, when we don't perform, there are certain measures, there are disciplinary measures that are put in place in order to correct our behavior, in order to assist us. We are, put into trainings, etc. The principle is the same. Of course, it may feel harsh because now we're talking about a person being detained and being labeled a criminal. But ultimately, we want to find ourselves managing the abuse that they also inflict upon us. And of course, it's difficult to communicate with such individuals because there's that mixed messaging. So you find that whatever agreements are made today, they're back, they backtrack, the following day, etc. Those are the truths that we need to acknowledge, because sometimes we get hurt because we set quite high expectations to say, but we spoke about this, but why? The reality is, like I said, they are not themselves fully because they are unwell. And in us being, let's call it denial, we sit with a lot of stress. We sit with confusion. We're always fearful. And then the big one is the financial problems that we find ourselves sitting with. Because my husband, um, is a gambling addict. And I continuously now have to go and take out loans. I continuously now have to, use my overdraft. Look at the financial burden that I'm now incurring because I'm struggling to manage this. I'm struggling to also, manage even the consequences. But instead, because we are fearful, we want to make them happy. We want to compensate, and we hope that our love will change them. Sometimes it doesn't, because they are no longer themselves. And mostly, the safety risks, where you start to hear now that so and so has done certain things that they wouldn't typically do. Those are the costs that we sit with. But we have a duty to ourselves, because whilst we love them, it doesn't mean that our lives must stop. You still have a duty to take care of yourself. You still have a duty to, yes, whilst you must understand, be informed about their condition, but you also, because you understand what the condition is and you understand what it comes with, you get to then start managing your expectations. Marie, go for it.
So there's a question that giving them tough love, would that make things worse or help them realize that they are actually loved? And what type of behaviors would be regarded as enabling an addict?
So, with tough love, whilst you may hear people saying, yeah, you need to give tough love, it differs because, you sometimes you hear of individuals saying, or other family members, loved ones saying tough love, and they lock someone inside the house for days with no food because they want them to start withdrawing from that particular symptom, and they call that tough love. So I would rather say it depends on what it is that you're doing. Whatever it is that you're doing, are we going to call it, stuff that you feel is moral? Is it ethical kind of behaviors? Is it you setting boundaries? Because when we speak of setting boundaries, that's where we can then start using almost that tough love, because we're saying it doesn't matter how much you're crying. I'll rather take you to the hospital rather than give you that particular substance, right? So it becomes important that we continuously love them. And even when we set these boundaries, we are still empathic. It's very important because we do not want to alienate them. And when, the question, that's the second part of the question is, what would constitute your enabling kind of behaviors? It is knowing that your partner, has a gambling addiction and you still give him your bank card to go and buy milk and bread. That's temptation. He has proved to you time and again, whilst I know your intention is for them to go and buy milk and bread, but are you not reading that context, understanding that this is their weakness? So in so doing, they're going to go and, withdraw some money. They are going to go and use your card for other things because they've got a gambling addiction. And you still give them the card again next week to go and fill up the petrol. So in there, you are enabling it. Yes, your intention is not to, it's because you're busy, but you need to be mindful of the truth and the reality of your context. It is in how we often hear people say, he had or she had a certain addiction. So we're not going to allow him to use a certain substance, but he can also still drink alcohol. That's enabling, because is that what the treating practitioners have recommended? Whilst I acknowledge that there's been, many treatment modalities where you hear of the importance of substituting the one for the other, but best believe none of them says substitute a substance for another substance. One may be told perhaps introduce tea at a certain time because tea will be calming, but nothing says, we move from this kind of an alcoholic beverage to this one because it's got a lesser percentage, as a means to assist an addict. Because the key word here is this is someone who is an addict. And at the core of an addiction is the inability to control. At the core of an addiction, if we are to speak of substances, for example, is the inability to recognize after one glass of wine that I'm good for the day. Once there's been one glass, it leads to 5 more glasses. So that's the reality. So that is how we start to enable. And often than not, we enable without intending to, but because we are wanting to show love. Hence, then I speak of these boundaries, which are important. And I started with staying informed, because being informed of what is going on will assist you to know how to support, so that when you have to set a certain boundary, you understand that this is a boundary that's within the, let's call it, the confines of their treatment program, and not what we think. It's what our loved ones need. And over and above that, nothing is as important as consistency. Can be quite tiresome because, remember, I spoke of, you know, it being also an illness of the brain. So they will continuously ask, and they will ask, just like what you do with your 5-year-old, where you say, no, you're not going to eat sweets at night. It's the very same principle. Even when we get frustrated and we're tempted to say, you know what, do what you want. You're an adult after all. They're definitely an adult, but there are repercussions to some of the things that they do. So protect yourself, because I said you now need to take care of yourself because you still matter in spite of taking care of them. You need the support. And if you're feeling that the social networks that I spoke about earlier are not doing it for you, seek that individual support. You know, attend those support groups as best as you can. Don't isolate. I made an example of how social invitations get to dry up. How about you take the initiative to connect with other people, you know, because ultimately you need this. You need to still exist outside of the addiction. Because if the addiction takes over, you're the one who is going to present with the most extreme mental health illness symptoms, because you are taking all of this in and you don't even have an opportunity, you don't have an outlet where you are taking out, all of this out, at. So it's important. Get alive, go and exercise, go to the gym, take care of yourself, sleep. And I know with parents mostly, I often hear, there's a worry around what is he or she doing in her room. There's only so much that you can do. As long as you've put in the basic, means of, let's say, containing the environment and making it as conducive as you possibly can, there's nothing else that you can do. You know, have those hobbies. Take time and see your relatives, have your passion projects. Go and visit, you know, um, the animal, perhaps shelter, take care of an animal, do something just so that we bring back that sense of purpose in your life. Because, like I said, this is an invisible family member. And if you're not mindful, if you don't take notice, you may find yourself having your entire life just, really being around, this illness. Take up gardening, do craft. There's quite a number of things that we can, actually do just to take care of ourselves. If it means, yes, there is that roster system that I spoke about earlier on, then so be it. But as best as we can as well, when we can see that there's still an active addiction that poses that risk to the well-being of the family, to the functioning of the entire household, let's seek that help. Let's go to these mental health practitioners and say, here we are, we're struggling. But with that being said, I also do want to acknowledge the fact that we as mental health professionals as well are the first to say to you, he is not ready, she is not ready, so we can't force. Yes, but we need to be consistent, and we want to work on the hope that at some point they will change their minds because they're realizing what is happening in the family. And moreover, one of the things that often brings people into the system where they get to now deal with their addiction, specifically around your substances, is because they've committed some sort of an offense of sorts. So hold them accountable so that they are able to get the kind of help that they need. Now, what do, support measures look like for loved ones, the carers that you are? Those programs, if you go to, the likes of your support groups, etc., they will assist you, with identifying, setting goals for yourself around how you want to help your loved one who's living with the addiction. And by setting those goals, you're able to stick to whatever, let's call it objectives and deliverables that you end up setting without, sometimes going the enabling route. And I say this with all due respect. I did say we enable without intending to. So having set goals helps keep us, let's say, in check, helps us to not forget what it is that we want to achieve. Furthermore, it assists you to, be existing in a space that is non-judgmental, where you get the opportunity to learn, discuss, and how to cope with the addiction that would be unfolding, right in front of you. Because sometimes we see it in the beginning and we minimize it. So it doesn't matter at which stage it's at, just so long as you're starting to be concerned. And I'm not saying let's leave here now with the ability to diagnose. We don't diagnose them. Let us, as the mental health professionals, do that. But once you are concerned about how the person is using whatever substance, how they're interacting with their finances, and you're noticing this addiction, you're noticing this addiction to pornography, you're concerned. You need to do something about it before it escalates into a real life situation that can explode. Rather, let us say no, it's okay. So when you then attend these support sessions as family members, if you are to attend the family therapy kind of supportive interventions, your individual kind of therapy, you also then get to normalize the experience. Because like I said, for example, with a parent, you may sit with, what did I do wrong? But once you are in a space where you're, exposed to the support resources, you actually get to understand that in actual fact, this is on them. You know, I don't take away the fact that yes, some individuals do come from, let's say, social systems where they've been exposed to certain things, and all, that we can say they could ever do was become addicts of whatever nature. But the reality is they still have choice, is the truth of it. So let's not forget that. And your supportive resources also assist you to break the sense of isolation, because I spoke of the shame, I spoke of the stigma, and that will keep you isolated. And you know for a fact that, if you are seeking the kind of support that you need, you always have the source of support in this non-judgmental holding space that will allow you to be, that will allow you to say anything that you may want to say. Now, in terms of what would be your responsive types of resources around, how do we help those, who are suffering from addictions? There's various, organizations that are available. It would be your AA, where they get the necessary support. It would be your NA, your Narcotics Anonymous. Sanka is also a very good resource, because they often know exactly, there was that question earlier on about where do I go to? They often would know where are the centers where we can, direct our loved ones. And as I said as well, let's not be shy to use the SAPS. Let's not be shy to seek counsel from the SAPS, even when we're not sure, by the way. And I'll give you a quick example of what I'm talking about. Sometimes you may have, okay, there's a bit of feedback that I'm getting. Sometimes you may find that a loved one who is, and I'm going to speak about cannabis, often than not, when individuals have used cannabis for a very long time, they sometimes experience what we call, um, excuse me, um, cannabis. It's sort of like you get a psychosis that's as a result of using the cannabis, right? So it's cannabis induced psychosis. So in cases like that, what I've often seen is that those individuals will get violent. They'll break things in the house, etc. And so sometimes it's okay for you to call the police, because the police will assist you to take the person to a mental health facility, not because they're going to arrest them, because at that point in time, they now fall under what we call your involuntary admissions within a psychiatric facility, because they no longer have the ability to make sound decisions, because they are psychotic, meaning that they are perhaps hallucinating, perhaps they are presenting with delusions. So sometimes, in our fears to be engaging with the police, they might be the source of support that we need in responding to whatever crisis we find ourselves facing. So let's not, exclude some of these spaces. If you need to be going to the doctor, if you need to be taking them to the hospital because you are noticing that they're now having seizures, rather than being ashamed of the fact that people will know that it means that your partner, your child, your sibling, your friend, is using a certain substance, rather opt to preserve life by going into a medical facility rather than sitting with that fear more than anything else. So on that note, I'm going to invite questions if there are any more. Vilmarie, I'm going to hand over to you.
Yes, so there was another question that I want to ask. What about working and living in an environment that is not conducive to one's recovery, but full of triggers, possibly even deliberate triggers?
Now, that's a very difficult one because we speak about living in an environment or working in an environment that is not conducive. And we need for that person to work because it assists them to still have a sense of purpose. It assists them to be able to be responsible for themselves and, have the ability to make a living. Um, and so one now has to choose between their wellness relative to what would be, home where one needs to be. In such instances, we often say, you know, coming into the counseling space is ideal. And I say this because you may find that whatever triggers there are, there might be a workaround to those particular triggers. So when speaking to a therapist one-on-one, you may find that you're then capacitated with certain coping tools that you can utilize while still existing in that particular space, right? Whereas on the other hand, there might be an individual where they really need to leave that space because the space is no longer conducive for them. And so, if it is individuals like that, yes, again, we've got your social services who can assist with, let's look for a place. Look at your social networks. Who can you tap into as a resource to assist you, perhaps as you try to find your way out of that home system, as you're trying to look for your own place, if there is affordability. So there's numerous options to it. So I would never ever say stay because we need the money. Because if you are in a workspace that is triggering, so for example, an individual who is working in a nightclub and they're struggling with alcohol dependence, for example, that's a significant trigger. It's a significant temptation because whilst I'm waitressing in that nightclub, there might be an instance where you interact with a difficult client, a difficult customer, and in that agitation, one then wants to do what we call self-medicating, which is to try and relieve the pressure of whatever, feelings that they're experiencing, those elevated feelings of anxiety, for example. So that is a place where we are likely to say not necessarily the best to be working at because of your particular vulnerability. So it really differs from the one person to the next. Sometimes there is a way to work around it, but often than not, to then just give you a blanket one, I would say, as best as you can, know your triggers. As best as you can, avoid the triggers. So if it means there is that family member who's still holding a grudge because at some point you had caused them, financial frustration because of your addiction, and they continuously make certain commentary, set boundaries with those individuals because in you showing up for yourself as well, you may find that they get to learn and they get to realize that indeed you have changed and you are going out of your way to ensure that at the end of the day, you're able to stick to your guns when it comes to you being in recovery phase.
Thank you. There's another question, and I think it's very interesting because I know the DSM classifies addiction as an illness, but the question is, if we classify it as an illness, where does choice then come in to play?
Okay. For an individual, whilst it's an illness, that's the truth of it, yes. But at the same time, remember there are moments when this person, yes, is going to be sober, and they are exposed to various avenues where they get to learn about things that they can do. So we don't say that just because they are now ill, pretty much like the example of a person going through a cannabis induced kind of psychosis, we are still going to hold you accountable and say, no, you need help, despite the fact that you were unwell. So we do still want to hold them accountable, hence the boundaries. So yes, there are moments in between where they are able to receive the different types of messaging that is being that is being passed across. Because with that being said as well, I'll tell you remember I spoke about manipulation. So addiction also comes with that sense of manipulation as well. So sometimes a person even, wears that character, puts on that cloak because they want to get their way. So those individuals do need to be held accountable, but we also do need to get them to a certain level where they get the necessary support, where they are fully psychoeducated, because as families, we do have the ability to teach them. But sometimes, because we are also emotionally involved, we are not well versed in terms of how we can support them and how we can conscientize them. Because even when they come to, your inpatient facilities, for example, like a rehabilitation facility, they are also held accountable. They are reminded, they are taught, around things that they need to do. And where they are doing wrong, yes, they are still, facing those consequences of whatever things or transgressions they may have found themselves committing.
Thank you. Um, I think as well, our time is running to a close. I'm going to ask one last question, and then I want to ask our participants if you have any further questions, please send them to tempo@bestmed.co.za, and we will then refer it to Lusanda to answer and also to be able to send it to you. So, the last question: what if you have sent your loved one to a rehab many times and to go to a mental facility as well, but still they go back to addiction? What is the next option?
Okay. We did say they are mentally unwell. I'm hearing mental health facility. I'm hearing rehab facility. There is a reason why there are so many relapses. And again, we want to be invited into the picture where you just want to understand, am I dealing here with, and I'm going to make an example, with a loved one who has perhaps an intellectual disability where they don't even have the ability to comprehend what they're being taught, and as such, they'll do as they see fit because that's a different outcome, and how you respond to that is different. And then there's also that person where they've gone through the program and you understand that they've been taught everything that they need to learn, and they continuously go back. Consequences and those boundaries that I spoke of then come into effect, because ultimately they learn that just because I relapse in inverted commas, they are going to take me back and they're going to hold me, etc. So you do need to still hold them accountable.
Thank you. Thank you, Lusanda. I think it was a very informative session for us today. And the two things that I myself is taking away from it is there's always a cost to caring for our loved ones that suffer with addiction. But also the main thing is we have to remember to take care of ourselves as well. We can't take care of them if we don't take care of ourselves first. So thank you so much. Thank you everyone for attending our session here today. Please send your emails to tempo@bestmed.co.za if you have any further questions, and we will see you all again at our next discussion group. Thanks, Lusanda. Have a great day.
Thank you very much.